Jonathan Wang, the founder of the Youth Advocates for Global Health Association.
Yeah, and my name's Matthew Yu. I'm the vice president of YGHA.
Today, we are pleased to be joined by Mr. Kingsley Nyandika, who is the executive director of the UCESCO Africa organization based in Nairobi, Kenya.
Yeah, thank you so much, Dr. Nyandika, for joining us. Mr. Nyandika is the founder and executive director of the United Cultural Empowerment and Social Community Organization of Accra, and a charitable NGO dedicated to empowering vulnerable women, children, and youth in marginalized African communities. He founded UCESCO Africa in 2010 after witnessing how small acts of support transformed a struggling family, and officially registered the organization on June 21st, 2014, scaling his compassion into sustainable community programs. Under his leadership, UCESCO Africa implements social development initiatives, including education, health, sanitation, and micro enterprise support, helping families break cycles of poverty and build resilient futures. Um, Based in Kenya with activities across multiple regions, the organization emphasizes community-led development and intercultural understanding. Mr. Nyandika's commitment to social change has driven its growth and strengthened its mission to uplift underserved populations across Africa.
Thank you, Matthew. But without further ado, let's give a warm welcome to Mr. Nyandika. Thank you so much for joining us today.
Thank you so much. Let me do introduction about UCESCO Africa. As already the introduction was done, was founded in 2010 in Rwanda. UCESCO Africa, by that time, I was working with one of organization in Rwanda. And in Rwanda, during the genocide, the whole country changed from French to English. So as I was volunteering and working in one of the organization, we used to do our volunteer work in the evening in various, universities, teaching them English and trying to impress the British culture. So most of the time I was spending my time at Rwanda National University of Rwanda, and I used to teach them English. So that's the time now the student they started getting to know me, and also they were always, seeking, assistance from me. So one day, Umtoni Wase was one of my students. She called me one night, and she told me that they are now internally displaced after they're being expelled by their in-laws, so they had no place to go. And during that time where I was working, there was a lot of bureaucracy in terms of seeking for funding. So I had to find my own ways of helping them. So I tried to create a WhatsApp group with my friends that we were working together, and that's how we managed to raise the 1,000 US dollars, and we assisted the family. So by that time, I was just doing it out of goodwill. I didn't know the impact was going to create, but I just did it at my own level capacity. So after three months, the family called me again, and they were so much thankful. I saw they already started some hotel business, and also the kids went back to school, and I felt so much, I was so touched. And that was the first time I felt a certain happiness in my heart that I could not measure out of the money or maybe the good things that I had. I felt so good, and I felt like I can able to continue to help more people. And that's how UCESCO Africa was started to change the lives of people in Africa. From Rwanda, we moved to Kenya, and right now also we are having programs in Uganda. Basically, that's how we started UCESCO, and since then we have created a lot of changes as well. So UCESCO, we have three strategic pillars of impact. One is education and talent development. So far, we have educated over 1,356 orphans and vulnerable children across Africa through our schools, providing and also we have provided around 266 scholarships to bright students who normally perform very well, but they cannot they cannot, afford to go to good schools. So we, as UCESCO, with our volunteers and well-wishers, we have managed to secure or to offer 266 scholarships for vulnerable children to join colleges and also high school of their own choice. And also we have established Emovet College. Emovet College is a college that we founded to empower women because we realized that when we empower the women, we change the community and also we change the family. So through M of Faith College, we empower young mothers through various courses like hairdressing because they are very marketable here in Kenya and actually most of African countries. Fashion and design also is a very good course that we also empower them. We also offer adult literacy for those young mothers who want to advance in their education. We also support them to achieve their dream, to pursue their dream. And also, for those who have kids, we have established some daycares whereby they can able to bring their kids. We take care of their kids and they can able to go back to their school. And we have seen so many women changing and so women becoming independent and also growing, changing their family. And through that one, we have seen a lot of economic, growth in the slums where we are serving most of these our programs. And also we also work with various universities in Kenya. Uh, through these universities, we engage students in a community empowerment program. We also start nurturing them so that by the time they are graduating, they can able to offer, their services to humanity, and also they can able to serve their community where they're coming from. So right now we are working with one of the biggest universities in Kenya called Kenyatta University. We're also working with University of Nairobi, Kisii University, Rift Valley College, and many other colleges are around. So I was in the second pillar of UCESCO Africa, that is healthy sanitation and nutrition. I think that's where Jonathan is more interested in. So far, uh, in the health department, we work in various, okay, we have different approach. The first, where we serve, we normally work in the slums and also some rural areas that is more marginalized. Like now in the slums, you find like people cannot access healthcare. And it's out of because of lack of infrastructure and maybe most of the health facilities are very expensive and most of them even they can't afford to have insurance. So you find some most of the residents of these communities, even if they are sick, they normally live with painkillers. And in the end, you find like we have lost quite a number of them because of lack of earlier intervention with or earlier checkup in the at the clinic. So we decided to have um, annual medical camp. This is actually the biggest medical camp we normally organize, the whole Africa. And during this medical camp, we invite all expertise from orthopedic, gynecology, all types of doctors that you can able to mention. Then they can come. We normally have like a 3 weeks medical camp. We set up everything. It's like almost level 4 hospital. Then these uh, communities members they can come to our clinic and they can get checked and also treated all types of diseases. And we have seen a lot cases and a lot of people they have really appreciated our contribution to the community. Like right now, since we started the medical camp, we have treated almost 35,000 patients in Kibera slums. We have also the second slum in Nairobi called Mathare slums. We also have Kariobangi slums. and also some marginalized areas like Samburu. And during this free medical camp, we also those serious cases, especially chronic diseases, we pay for their insurance for 1 year. They can able to get checked and also follow up to make sure that they all get to back to their normal work. Also, under the second pillar, we are also fighting malnutrition because the community we are serving, there's a lot of issues of malnutrition. The kids are not well taken care of. So you find most of kids are suffering of various diseases because they don't have opportunity to get enough or balanced diet. So what we do, we have the centers within these slums, like now Big Lucas, and we try to provide balanced diet, breakfast and lunch, to try to fight the malnutrition in Kibera. So right now we have almost 676 children that we feed every day. We make sure that they have eaten breakfast and lunch in various in most of our schools. So it's a school, but at the same time also we are fighting malnutrition by providing the quality food, as also getting education as well. Also, for some statistics that we have done in Kibera, almost 77% they lack proper wash facilities. So it means only 30, maybe 32 points, point something population that can able to acquire like piped water or the wash facilities, but 77% they lack a proper wash facilities. And that's what we are trying to fight as organization to make sure that all these people, they can also, they deserve to get a better service in terms of hygiene and also sanitation as well. The third pillar that we also working is a micro business and agriculture. It's also one area that we are also using it to fight food security and also to provide a sustainable solution for the people in the slums. One, we launched 200 women-led business, and the reason why we had this business is to empower the women so that they can be able to provide and also to take care of their children to grow healthy. So we try to support these women, those who can able to do various business. They come, we train them for around 3 months, and then for those who show interest and also who are willing to start a business, we help them to start a business, and also we support them until they get set to proceed by themselves. And also we are trying also because Kibera, one of the most problems that they are facing is environmental hazards. So we are also trying to clean the rivers within the slums and also trying to plant trees. And so far, we have planted around 20,000 trees through Go Green campaign in Kenyatta University, within the slum, and also within the city to try to fight the environmental diseases that are being caused by the poor pollution or maybe the environmental hazards as well. So far, these are some of the milestones that we, as organization, we have achieved. So we started a 5 year strategic plan, and we started from 2022 to 2026. So it's going to end to 2027. But from 2022, you can see we have managed as organization to raise 8 million Kenya shillings through Frontier Program and also Well Wishers and online campaign. And we have touched 64,750 lives in the Kibera slums, Mathare slums, Kariobangi, Samburu, Mombasa, Uganda, and also Rwanda, where we started. And also indirectly, we have touched almost 343 lives. That's maybe through the family. If we help one woman, we have touched the whole family. So we can combine. We can able to see that we also touched indirectly almost 343 lives as well. We have also educated more than 1,354 orphans and vulnerable children in these marginalized areas where we are serving as organization. So under the education, one of our achievements that we have done under education, number one, is a comprehensive educational support from scholarship to in Begilucas is one of the school that we founded also, and we started with 23 kids, and right now we have almost 287 students learning in our school and also enjoying our balanced diet to improve their health as well. We also founded Movet College, and so far we have trained almost 116 women for economic independence, and we have seen a lot of them changing a lot. In terms of healthcare, some of our achievements that we are celebrating also is free medical camps providing essential healthcare services to underserved communities annually. Um, we started in 2022, we started with 5,000 patients. And last year, 2025, we managed to treat almost 14,000 patients, and they were very thankful to the organization and also to the well-wishers who supported us. Um, Most of the areas that also we focus in the slums, that most cases that we are having in the slums is TB issues, HIV and AIDS is very common in these regions, and also maternal health also is a big problem. So those are the areas also after the medical camp, we try to see on how we can able to help as much as we can, because also it's a very common cases that we are facing in these slums where we are serving. And then in terms of community developments, one of the achievements that we have achieved is sustainable initiatives addressing environmental conservation and economic empowerment for vulnerable population. Already I mentioned we have planted 20,000 trees across Kenya since 2022, which is actually we have tried to fight or to improve the environmental environment, the health environment. We have also trained 200 women-led business launched in rental and also in agriculture. And also we have, right now, we have 676 children who receive daily breakfast and lunch as a one way of improving their health and also to fight malnutrition in those areas. Okay, so I wanted to show you the scholarship distribution growth since 2022 to 2025. UCESCO Africa Scholarship Program demonstrates remarkable growth, expanding from 23 students in 2022 to 111 students in 2025, with primarily focus on vulnerable communities, including Kibera, Madare slums, Samburu girls, and various secondary schools. So you can see in 2022, we started with 23 vulnerable kids. 2023, we moved to 47 students. 2024, 85 students. 2025, 111. So far we have touched 266 vulnerable kids who are now almost completing their universities. Some are in the college and some are also in high school. So when you see the growth, expanding healthcare access, patients' numbers nearly tripled from 5,000 to 14,000. demonstrating UCESCO growing operational capacity. So you can see like every year the pie is keep on increasing. It means we are also trying our level best not to go down, but to try our level best to help as many people as possible every year. Strategic outreach location, medical camps serve Nairobi and Samburu and include we also do specialized dental camps. And so far, we have touched almost 350 patients on top of the medical camp. That's purely in dental area. And because we have a lot of dental issues in the slums, because I think because of water and also contaminated water is affecting their oral issues as well. We have also done some infrastructure construction of schools, like now in Bekulukas, started with 2 rooms. Right now we have 10 rooms. Silver Spring also is one high school that we have built, and right now it's having almost 600 students. And New Horizon is also serving around 180 students. And Samburu transformed from learning under the tree. They used to learn under the tree, but right now if you come, we can able to see 2 permanent blocks serving 136 kids. Um, some of the health crises that in Kibera we have faced, at least to understand clearly the situation. As you can see, the water access crisis, only 31.6% of households have piped water access in Kibera. So you can imagine the other 77 point something cannot afford or they cannot access health, piped water. So it means they have to buy from kiosk, and most of those waters are contaminated, and that's why we are having a lot of cases of diarrhea and many other cases that's from waterborne disease. Sanitation gap, 77% of residents lack proper wash facilities, leading to also health crisis. And also we have disease burden, 50% of the people living in Kipera, most of them have either TB or HIV/AIDS. Co-infection rates, not many clinics also treat TB patients. So once you have a TB, it means you're gonna struggle a lot to get assisted. And child mortality, you can see is 19% under 5 mortality reported in some of the areas that we are serving. And you can see 90% of diarrhea cases is out of uh, water contamination as well. Now, this is our approach, at least to understand how we approach this issue. The first, we normally identify the need. That's a community assessment and vulnerability analysis. Here we normally use every 100 houses, we have one community health promoter. So this community health promoter is the one who analyzes and find which are the serious cases that we need to tackle first. And then secondly, you can able to see we direct intervention. That's now where we provide scholarship. For example, if they go to a family, they find this a child who's not going to school, and you have to find out why he's not going to school, and then if maybe it's school because of the school fees, then we have to find ways to make sure that this child has gone back to school. Another intervention we do is the medical camp. Already explained how we do the medical camp and how it's touching the lives in Kibera. Another thing we do is infrastructure, building schools, and also the facilities to make sure that these communities they can able to access the services as much as they can. Then also we have local leadership. Our approach is a bottom-up approach, so that when you use this bottom-up approach, we are making sure that even in future, without UCESCO, still this community can able to continue, surviving. So bottom-up strategy, we train the members and to make sure that they're independent, they can able to live by themselves. If the women, we don't just give them handouts or maybe buy them food, but we try to ask them, what can you do? How can we help you? If you have skills in the business, we sharpen your skills and then we open for your business. Or we train you if you are doing a small business, we train you on how you can able to grow, on how you can able to set, a dream and also make a plan, financial literacy as well. So you find like this approach, we have educated as many kids as possible. We have empowered the women. So you can able to find like even if tomorrow there's no UCESCO, these families they can able to still sustain themselves, and that's the approach that we do as UCESCO. And lasting impact is self-sufficient communities, ripple effects, or reaching 5 times more people. So through this bottom-up approach, you find like even the impact is touching like 5 times more people who are on the same line. So like you have touched 5 more people. You touch one life and then you have touched indirectly 5 times people for 5 more people. So that's the approach we do as UCESCO, and you have seen it working very well. So thank you so much. That's a bit introduction about UCESCO. I think now you understand what we do. Thank you so much.
Well, yes, thank you, Mr. Nyandika, for sharing UCESCO's story and growth and how the organization is breaking healthcare disparities one step at a time. Our first question for you would be, what would you say has been the organization's most successful project in terms of promoting education or social innovation?
In terms of education, one of our successful project is we have a project called Big Lucas that this project has touched quite a number of lives because we in that school we provide uh, balanced diet food, and also we have quality education, and most kids they have we have seen a lot of kids improving through our program. Another project that also has did work very well is health awareness. We do health awareness in house to house through community health promoters. And through this one, we have seen we train the community on how they can able to treat the water and also the best way they can able to cook. And also it's a project that we have seen that has really changed the community, and also the people have improved in terms of health as well.
All right, thank you so much for that response. I had a question about like how does UCESCO ensure its programs help these vulnerable communities in the long term? So not just short term help, but also its sustained long term commitment.
Um, when you saw the our approach, we normally approach in a bottom-up approach. What does it mean? When you approach uh, bottom-up approach, it means you are empowering this community uh, to live independence, or to like um, I don't know how I can put it. For example, we focus in education. Most of organization, what they do, maybe they do most of aid, providing them food for today. But you can see as UCESCO, we are very much focusing on education, economic empowerment, and also health and skill developments. Why we are doing this one? Through education, these are skills, these are permanent skills we are giving this child to survive using the bottom-up approach. Secondly, we do economic empowerment. We empower these women to be independent in terms of owning their own business, setting out their own business, and we train them on how they can able to sustain their family through the business. Then we also provide skill development. We train these women, we give them the skills, and that's how we believe that through this one we are giving them a permanent skills that they can able to help them. And you can see some of the key strategies of achieving these long-term sustainabilities. For example, when you talk about empowerment and skill development, now UCESCO, we prioritize equipping individuals with the skills necessary for independency, including like a vocational training, training for young mothers and adult literacy programs. You know, some of our adults, they never went to school, and we try to make them to try to encourage them to go back to school for those who are willing, and they can able to acquire the certificate and start benefiting the Kenyan other person. So that's how we are approaching this bottom up, and I think it's a sustainable way of helping these people. Now, when you talk about education access, we offer scholarship, already I mentioned, to underprivileged students. We build schools, classrooms, and provide education resources to help break the cycle of poverty and also marginalized communities. And then when we talk about the economic independence, the UCESCO Africa, we try to promote women economic empowerment through microfinance, allowing them to establish business and also reinvest in their families. And when you talk about, something like healthy and nutrition support, as UCESCO, in addition to medical camps, we enhance community health by educating on nutrition, sanitation, and hygiene. We also implement feeding programs to address malnutrition in schools and slums, so at least these kids they can able to be healthy. And in terms of capacity building, also is one way also we do as a long-term approach, bottom-up approach, whereby we employ grassroots. We train the local communities members to assume leadership. So when you come to our project, you find the people, the leaders, most of them are coming within the community, and through that one, we are sure that they can able to maintain by themselves. When you talk about infrastructure investments, we try, as you said, we try to create sustainable facilities such as, you know, daycares in the slums areas, enabling parents to work and enhance community safety and also livelihood. We also do mentorship and nurturing these people. Uh, like now, in Kibera, before we used to have a lot of issues of in discipline and also crime issues. But now through our mentorship and also having sports with them, we try to impact life skills like discipline, teamwork, and leadership to youth, thereby reducing their involvement in the crime and social issues as well. So basically, that's how we approach it. And maybe I hope I've answered you well.
Amazing. Well, yeah, that's so wonderful to hear how UCESCO has really aligned itself with the sustainable development goals of the United Nations. So that's what's so wonderful to hear. What would you say are the main healthcare challenges faced by residents in Africa's largest slum? Because I remember earlier in the presentation you mentioned how a lot of patients rely solely on the use of painkillers, which obviously is not much of a sustainable long-term solution for their health. So what would you say are like the overall main healthcare challenges?
Uh, Actually, where we are serving Kibera is in Nairobi, is actually acknowledged as one of the Africa largest slum inhabitants. Face, and being the largest slum in Africa, one of the challenges the residents face is severe poverty. And number two, there is a challenge of overcrowding and also lack of essential infrastructure. So these challenges, for example, they end up because of overcrowding. You find like there's an issue of environmental health hazards like water and sanitation, like a severe shortage of clean water and adequate sewage system leads to elevated rates of waterborne disease illness. such as cholera, typhoid, and also many other diseases that come out of waterborne diseases. So numerous residents depend on shared, frequently contaminated water sources, or maybe resort to using a flying toilet. We have a flying toilet. This is plastic bags due to lack of enough latrine. So when we don't have some areas that they don't have enough latrine, so they have this issue of flying toilet whereby you pack, you use the paper bag, and then at night you just throw anywhere on the street. So you find like at the end of the day, if it rains, all these contamination goes to direct to the water, and you find like it's affecting the community as well. Also, we have a high burden of communicable diseases due to population density and also inadequate sanitation. Infectious diseases are widespread, accounting for a substantial number of fatalities, particularly among children under 5. Major threats include one is acute respiratory infection, that's pneumonia, then TB and HIV and AIDS. Those are some of the issues that's also affecting the community. And also we have lack of accessible and affordable healthcare. We find like the formal healthcare services are often um, expensive, forcing residents to depend on either unregulated or unlicensed or inadequate staffed clinics. Many individuals cannot afford to the cost of the fees or medication or consultation. So you find like instead of going to a good clinic, but since they can't afford, then they end up going to maybe unlicensed clinic or unregulated clinic, and they mess with their health as well. Also, another challenges they face is poor infrastructure affecting emergencies. Like now, Jonathan, you've been in Kibera, you saw how the population is so overcrowded. So the narrow and congested and unpaved roads hinder even ambulance access, resulting in delay that can also be a veto. So you find like all those kind of poor infrastructure, even if the ambulance is willing to come and help, but it's not accessible because of that overcrowded people or population. Also, we have an issue of high poverty and nutritional deficiencies with numerous residents. They earn less than $1 uh, and per day. So you find they can't afford food, and also they can't even afford for even to take care of their health as well. So because of that poverty, also it's one of the areas that is affecting the resident of this area. And also we have a rise of non-communicable diseases. Alongside infectious diseases, there is an increased prevalences of non-communicable diseases such as diabetes and also hypertension, often, worsened by poor nutrition and also limited access to long-term care. So you find also it's a big issue in this area. And also there is a mental health and security issues, high rates of violence, crime, and sexual assaults, particularly impacting the women and girls, resulting in a significant uh, undressed mental health concerns. So, some of the, you know, our assessments, we realized like in some parts under 5, mortality has been reported as high as 19%. Roughly 50% of people treated for TB in some clinic are also HIV positive. Uh, about 31.6% of households have access to piped water, and roughly 77% of residents have limited access to proper water sanitation and hygiene. So it's a very challenging situation, but we are trying as level best to make sure that we can able to help as much as possible. And this actually stakeholders, even other stakeholders, they can come and also see and all collaborate. We see how we can able to help as much as possible. Those are some of the challenges I always see around there.
Yeah, thank you so much for sharing. And so, um, I think we've learned a lot about, the work of UCESCO, and, you talk about all of these, free medical camps, the feeding programs, sanitation challenges, all the issues you just addressed. I'm just wondering, what is, the local government done to contribute to alleviating some of these issues, and whether or not you're working with local governments to help solve these issues together.
Yeah, so in terms of uh, the local governments, is as much as I know, maybe they have the plan uh, to chip in. But one areas that I see like if the government can come on board, especially uh, we plan together and we try to share the for example, like as an example, as in Kibera slums. So, as a government, as much as they have tried their level best to help, like now in Kibera, we have one public hospital, which is actually is well equipped, but the problem is only one. And in Kibera, we have uh, almost 1.5 million people. So you find like even if as much as they have tried, but there's a lot of queue, and also sometimes you find they have run out of medicine. Sometimes even they don't have maybe enough personnel. So you end up like some of the residents are not really accessing the health care that they are supposed to acquire. So, and for example, you find like all my thinking was that as much as yes, they have tried their level best, but if we can able to as stakeholders come together and plan, because like as an organization, we have that potential to train community health promoters, the community in terms of awareness. If the government also they can help us in funding and helping us, then I think we can able to do much. But for now, I can say these are big challenges. That's why uh, we have not achieved what we really wanted to achieve.
Yeah, thank you so much for sharing that. As you know, Matthew and I are global health advocates, and we really believe in the power of education in spreading awareness. So what role do you think education plays in raising healthcare awareness in places like Kibera?
Yeah. In terms of education, you see, we want this community to own and also to become more proactive. So right now, maybe most of them they're through the education. Like now, when we go to school, we share the awareness. Then it means these people they can able to understand from the beginning on the the problem or the issues that they are facing in terms of healthcare, and this awareness they can able to take back to their families, and also they can able to implement. So through education, we are trying to uh, instill this uh, uh, awareness in these communities, and then they can able to own, and then they can able to implement by themselves. So through education, when like for example, last week we had a training about uh, hygiene because we are like most of the clinic, most of cases we are facing is a hygiene issue. So we first of all we started training. We form women groups, and these women groups we try to train them to impact in to train them on how they can able to improve their hygiene and then how they can able to implement their family. And then secondly, we also go to schools. We also try to instill the same information. And through that one, we are trying to make it like a culture. At least they can able to understand and also they can able to implement as well.
And on the topic of education, so Jonathan and I, we've spoken to like for instance Dr. Rose Leishman in the past, who's done a lot of humanitarian work in the Central African Republic, and she runs clinics down there, and she also emphasizes the importance of education for patients. And one of the things that she brought up was just the prevalence of the use of traditional medicines of people in the region, and how they often conflict with some like Western medicines, and how she's educating patients about the difference. I was wondering if there was just this proliferation of, I don't know, the use of like traditional medicines in these areas as well, or if that's not as much of an issue.
Yeah, traditional medicine, they're very common in rural areas, but in the slums, it's not common. But if we are able to, if there's a way that they can able to also have opportunity to learn about traditional medicine, I think it will gonna be a very good idea. But it's not common right now in Kibera, and it's something that we can able to introduce. But in the rural, it's really working very well because still people are living in a traditional way, and those long days ago, that's how our co forefathers used to live, and then they're trying to some tribes they're still using the traditional medicine, but in Nairobi, it's not common yet.
Okay, sounds good. Are To wrap things up, you've come a long way since the establishment of UCESCO in Rwanda in 2010 when yeah, it's truly admirable how far the organization has come. What is one piece of advice you would make to change makers worldwide who want to make a real tangible impact?
One, one thing I can tell is that first of all, let's focus on sustainable solution, and and it's my appeal to all organizations who are trying to help these vulnerable people that to try at least to think of the long-term solution because even myself, because somebody sponsored my education, that's why I'm different from the my colleagues because if without education, maybe perhaps I was also homeless or maybe living on the streets. So one of the things that I've seen that's really making a great impact is economic empowerment and also education, educating these vulnerable people. So it's a very cost things, but you touch lives forever. So what I can able to advise that, especially in these marginalized areas, yes, most of them they don't have information. Some of them they cannot access. They are not digital, so they cannot access much of the information. But through the training and also empowerment, you can able to make them to think out of the box because most of them have great dreams. They have great giants in them, but they don't know how to implement. So through my experience, I can see that most organizations they spend a lot of money, but in a wrong way. But if you go deep, work with these communities, um, they own the project, they think by themselves. The impact is so powerful more than just uh, you know giving aid or maybe just giving the money or what. But I see that these people, they have solution, but it's only they don't know how to implement and what to do. So the biggest the advice I can able to get is that as much as we are blessed, we have what we have. Let's also think about those underserved communities, people who are struggling. Also, we can also support them to uplift them up to be on the same level like us.
Wonderful. Well, Mr. Nyandika, as always, it's a pleasure talking with you. Thank you so much for sitting down to speak with us today. We will post a donation link to UCESCO Africa in the description of this video. And Matthew, if you have any final thoughts, closing remarks.
Thank you, Mr. Nyandika, for joining us today and taking your time out of your day to really tell us about just all the wonderful work that UCESCO has done, and just also raising awareness about a lot of the very, very pressing challenges that are going on in these regions in Africa. So we really appreciate it. And hopefully, as I alluded to before, maybe I could come in, maybe with Jonathan, and we could come visit Monday.
You're most welcome. Thank you so much.
Mr. Nyandika, I'll see you very soon in Kenya, and we'll talk soon.